tics and Tourette's,
Yep.
and again, this is something that people associate with swearing from the documentaries.
Yeah.
Tics occur in 1% of the population.
Wow.
Most people don't notice that they've got them. They sort of wax and wane when kids are younger, from about 4 or 5. There's often a peak around 11, 12, 13.
Okay.
And then for 80% of people, they go away. So when you speak to parents, because there's a high genetic component to it, they'll say, no, I didn't. And if they speak to their parents, they'll say, well, no, you did. When you were 6, you used to do this. But yeah, often people just have extra eyelids, and that's it. They don't really have the swearing. That's the very severe end. And to be honest, if you made a documentary about someone with extra eyelids, it wouldn't be very interesting.
Yeah.
But for a very, very small proportion of people, these kind of tics will get in the way of life, and that's why, again, it's important to identify and see if they need help with it. Or with most people, just the explanation of why they're there can really help, because one of the major differences between children, especially adolescents and adults, is that feeling of being different. As an adult, you kind of want it, and you want to stand out from the crowd in different parts of your life, but as a child or an adolescent, you really don't. You want to sort of hide a bit because all these changes are happening. And any of these kind of differences, especially if they're seen negatively, kids making fun of you for blinking, or teacher telling you you're lazy, it can really chip away at your self-esteem. And like I said at the start, these are the kind of things that could be contributing to later depression or later anxiety.
Okay.
And so that's why it's really important to look for them, because then you can do something about them and stop the child becoming depressed or anxious. Yeah.
So we discussed things like ADHD. I mean, when we get patients to come and see us, they're obviously very concerned. What kind of age group would they be picking these things up, or is it something they could probably let go for a year or two and say maybe we can discuss it later?
Well, unfortunately, the way our resources are set up in the NHS is that there's I think about 800 or 900 child psychiatrists in the country, which isn't very many for a population of 68 million now. And so there can only be a finite number of people that we can see, and if you think about all the broad spectrum of conditions which we've still got to go into, that's quite a lot of kids. And so there are thresholds left of where you need to be in terms of severity before you get seen within the NHS. But that doesn't necessarily mean you don't need help or support. From a ADHD point of view, if your child has these kind of signs, you want to pick it up as early as possible, because the earlier you intervene, the less issues there will be in terms of effects on the self-esteem, the better progress they get academically and socially, because things like impulse control, if you just get carried away with your emotions or say things without thinking, that can really affect your friendships and ability to form relationships. And the earlier the identification, the better the prognosis for the child, really. And the threshold for medication, for instance, what I say to parents is that there's 2 things you need to look at. These kind of symptoms related to ADHD, so that's not being able to focus, not being able to sit still, and not being able to rein your impulses. Does that get in the way of functioning on an everyday basis? And does that affect their self-esteem and well-being? And if the answer is yes to those 2 questions, then medication is an option.
Okay.
But unfortunately, like I said, the way that NHS resources are such is that often things are deemed around risk because of some of the cases that we do see, and where I work, it can be several months before you even get seen, which by then things can deteriorate quite quickly, and unfortunately a large proportion of parents are then forced to go into the private sector.
Okay.
It shouldn't be that way, but I think when you're a parent, you've got to do what's best for your child.